So today, I'm responding to my opponent's claim that Medicare for All is a bad idea for the American people at this time. My opponent's secondary claims include that 1, Medicare for All will be extremely expensive, and 2, that universal health care is unfeasible at this time. I will begin with my response to my opponent's secondary claim number 1. My opponent says that Medicare for All will cost $33 trillion during its first 10 years that it's implemented, but will actually save the country and its people money instead. Copays, deductibles, drug prices, and healthcare costs all add up. According to MedicareForAll.org, in 2016, the average working family paid $6,273 per year in premiums and deductibles to private insurance companies. With Medicare for All, a family of 4 making $50,000 per year will only pay $466 annually in taxes for single-payer health care, leading to nearly $6,000 of savings per year per family. This system directly saves money for the people. Healthcare in the United States is expensive even with insurance. According to Yoni Bloomberg, who is an associate reporter at CNBC, who followed a 2017 Bankrate survey that stated that 1 out of 4 Americans forego treatment due to costs. This avoidance could mean life or death. With insurance, the patient faces the issue that the facility that they're attending does not have a contract with their insurance company, but they continue to perform the treatment anyway with little to no coverage. Bloomberg goes on to discuss that 18% of hospital administration ends up with some sort of out-of-network cost, often because the patient goes to an in-network hospital but gets care from an out-of-network physician. Single-payer healthcare shifts the way we pay for healthcare without increasing the overall costs. Steffi Woolhandler, an American primary care physician and medical researcher, states that doctors and hospitals negotiate contracts and fight over bills with hundreds of insurance plans with differing payment rates, rules, and requirements. Simplifying this method would free up more money while also expanding and improving on coverage. Woolhandler goes on to discuss that the single-payer system has administrative efficiency in stating that billing costs primary care doctors $100,000 apiece and consumes 25% of emergency room revenues. This billing and administration accounts for 1/4 of the United States hospital expenditures, which is twice the level in single-payer nations. With the single-payer system, it would cut administration by $500 billion annually and put that money toward care. I will now discuss my response to my opponent's secondary claim number 2. My opponent says that universal health care is unfeasible at this time, but does not take into account the positives of healthcare that is not privatized. Single-payer healthcare keeps the billing process simple. It is run by one nonprofit public agency that is accountable to the people compared to 1,300 health insurance companies and an excess number of government programs. Kimberly Amadeo, who has 20 years senior level experience in economic analysis and business strategy, states that the United States doctors deal with many private insurance companies, Medicare and Medicaid. Single-payer healthcare standardizes billing procedures and coverage rules. Then companies no longer have to hire staff to deal with different insurance policies. This means that anyone can visit any hospital and any physician without worrying that they will not accept their insurance, and everyone is paying the same price. Because everyone is at the same level, doctors and hospitals are forced to provide the same level of care at a lower cost. Amadeo goes on to discuss that the United States has a fiscally competitive environment that targets the wealthy. Doctors then focus their attention on new technology and offer expensive services because that's where they know the money is going. With universal health care, everyone gets the help that they need despite their economic status. For example, Canada has successfully implemented the single-payer system. Bloomberg discusses that after the system was implemented, Canada's performance was ranked 9th in comparison to high-income countries, while the United States healthcare system was ranked last. Although my opponent says that universal health care will cost too much money, and the United States is not prepared for the shift in policy, that is simply not the case. The single-payer health care will lower the cost of copays, deductibles, and drug prices in the United States, while saving the country more and more money the longer the system is implemented. Medicare for All's efficiency and affordability will lead to a healthier America. Thank you.
the structural things are pretty sound. On the first point, when you're talking about the cost issue, you have an explanation about what the average family would be paying and how much it would change with the, they'd be paying in taxes to cover that. That's, interesting information. I'm not exactly sure what it's based on, and it doesn't necessarily address the total cost issue, but it does address individual cost issues, and I think that that's important. Then you kind of suggest a variety of factors that are increasing cost, including the administrative process and the difficulty that doctors have with dealing with multiple providers of insurance and so on and so forth. And there was one statistic that said that the cost was twice as expensive. 1/4 of the cost is administrative, which is twice as big as what is provided in other places where they do have single payer kinds of systems. And then at the very end of that argument, there's a piece of information that says it would save us $500 billion a year. So I'm just doing math in my head for a second, and I'm going $500 billion a year. All right, times 10 years, that's, I'm trying to figure out how much that ends up being, $5 trillion or something like that, okay? And if we're talking about $33 trillion, that's, I'm not sure that's the trade-off that's sufficient, so there may still be some issue that's going on. And I'm just thinking in my head, not doing crunching numbers. Accountants would do all that kind of stuff, trying to figure those things out. But I thought that you made a reasonable argument on how there could be substantial cost savings by switching to the single-payer system. On the second point, about it being impractical, I think that you did a good job arguing why it's difficult to look at the system now and say that it is a practical system, because you've got these doctors dealing with maybe 1,300 different healthcare providers and insurance companies, and that's particularly problematic. The notion that there's an incentive based into this for performance based on costs or what people can charge, I think that might be the basis of further arguments about this issue. If we were having a healthcare debate on that, there might be some incentive to suggest that that's a reason why we want to have that, because that's the kind of thing that develops innovation and that kind of stuff. But in your argument, it really seems to deal with the notion that everything would be equitable and fair, and people would have relatively equal access. And I thought that you did a pretty good job explaining that. And then the comparison to Canada, it gives us one exit example as an illustration of that point. There's not a lot of discussion of what the advocates' evidence was talking about, but rather kind of the generic argument on the other side. And I thought you did a good job presenting that. All right, thank you.